Yeah, garbage and rodents and homeless and feces on the streets. We've been hearing a lot about that in recent years, and it seems to be getting worse. We've seen it, reports out of San Francisco and also Los Angeles. And there's a writer at the LA Times named Steve Lopez, and he's been walking around this Skid Row area of downtown LA and really finding out some really bad stuff. And you can see this picture right here of what some of these areas look like. And he writes in the article, the trash trucks arrived very early Wednesday afternoon, and members of the cleanup team from the LA Sanitation Division came with protective coveralls and white masks. A mountain of rotting, oozing, stinking trash awaited them, stretching a good 20 yards along a Skid Row alley. Rats popped their heads out of the debris like they were in a game of whack-a-mole, then scampered for cover as a tractor with a scoop lurched toward them. Yeah, so it's obviously getting really nasty in Los Angeles, and Mr. Lopez has done a really good job of keeping an eye on it. And what he does is, a week later, he writes about the same situation. He says, the good news is that two trash-strewn downtown LA streets that I wrote about last week were cleaned up by city work crews and have been kept that way as of this writing. The bad news is that I didn't have to travel very far to find more streets just as badly fouled by filthy mounds of junk and stinking, rotting food. And this all came upon the news, of course, last week that the LAPD station on Skid Row was cited by the state for rodent infestation and other unsanitary conditions. And that one employee there was infected with a strain of bacteria that causes typhoid fever. He goes on to say, what century is this? So here we've got thousands of people huddled on the streets, many of them withering away with physical and mental disease. Sidewalks have disappeared, hidden by tents and the kinds of makeshift shanties you see in third world places. Typhoid and tetanus are in the news, and an army of rodents is on the move. On Thursday, I saw a county health inspector on rat patrol between 7th and 8th Streets on Skid Row. He was carrying a clipboard and said he had found droppings and other evidence of rodents, and I asked where. Everywhere, he said. So, the city of Los Angeles has become a giant trash receptacle. So it's getting really bad. And that really brings me to what Dr. Drew had to say. Dr. Drew Pinsky, he's the TV celebrity physician that many of you probably have heard of. And he says that the city's in a complete breakdown. He was on Laura Ingram's TV show, and he said, we have a complete breakdown of the basic needs of civilization in Los Angeles right now, Pinsky told Ingram. And he says, Los Angeles had a typhus outbreak last summer and will likely have another this summer, Pinsky said. Meanwhile, bubonic plague, a pandemic that killed tens of millions of people during the 14th century, is likely already present in Los Angeles. This is unbelievable. I can't believe I live in a city where this is not third world. This is medieval. So, well, let me go ahead and talk about some of these diseases that Dr. Pinsky is talking about. And the murine typhus. California did see a large number of murine typhus or flea-borne typhus cases last year in 2018. And it's caused by a bacteria called Rickettsia typhi. Murine typhus is spread to people through contact with infected fleas. People get sick with murine typhus when infected flea feces are rubbed into cuts and scrapes on the skin. In most areas of the world, rats are the main animal host for fleas infected with murine typhus. And we go here. Most cases of murine typhus in the U.S. are reported in people from California, Hawaii, and Texas. Now, in California, here's a nice chart from the Department of Health, and you can see, yes, it is endemic there. But you do see, particularly since around 2010, 2011, that the cases have really risen, hovering around about 100 cases a year. Last year, 2018, saw 174, so a large amount of cases. And there have been about a dozen cases reported so far this year, so it looks like it's not quite as high, but we'll see. It's still early. And then, of course, there's the plague. Pinsky thinks that the bubonic plague is already in Los Angeles. Is it? I don't know. Could be. We haven't seen any cases. But plague is found in the United States. In fact, during the first decade of this century, 2000 to 2009, the United States was ranked number 11 in the world in human plague cases. We had 57. You can't compare that to the Congo or Madagascar, which saw thousands and thousands, but we were number 11. Now, plague was first introduced in the U.S. in 1900 by rat-infested steamships that had sailed from affected areas, mostly from Asia. Epidemics occurred in port cities. The last urban plague epidemic in the U.S. occurred in Los Angeles 95 years ago. Plague then spread from urban rats to rural rats and became entrenched in many areas of western United States. So right now there's two general regions where human plague is found. That's in the northern New Mexico, northern Arizona, and southern Colorado, and also California, southern Oregon, and far western Nevada. And if you take a look at this map, this is for the past 47, almost 50 years, the vast majority of human plague cases in the United States have been right here in the West, heavily concentrated in New Mexico and parts of Arizona and Colorado. And it's never been seen east of the Mississippi. There's one case here in Illinois, but never east of the Mississippi. Now, California puts out this map, and as I said, it is endemic, which in other words, it's naturally occurring in many parts of California. Plague in California occurs in the mountains and the foothills, shown in the shaded regions that you see in this map over here on the right. It is absent from the Central Valley and the southeastern desert. Plague is most common in rural and undeveloped mountain regions, as well as the suburban foothills of some larger cities. Plague has not occurred in urban or developed areas of California in nearly 100 years. So typhus is here in California endemically. Plague is endemic in California. So are there concerns? Yeah, there are in the data was that there was less than 350 typhoid cases a year in the United States, which is also true. And in fact, about 8 to 9 out of 10 cases of typhoid in the U.S. are due to overseas travel. Very few are contracted here in the United States. Now, I always like to look at how some media report this stuff and see how hyperbolic they might have got, because it happens. And this is a report from The Blaze. And it says, remember that time over a quarter of the world died horribly? Yeah, that's where LA is headed. Well, I don't know about that. It's quite a different thing than what we saw in the 14th century. But what we do know is we're seeing a breakdown in public health in some of these areas. We're seeing, if you talk to most public health experts, they'll say the things that save the most lives in human history are vaccinations and sanitation. And right now, in some areas of the United States, we're failing on both counts. So there is something to keep our eye on, and I don't know if there's really a valid excuse for what's going on in Los Angeles or what's going on in San Francisco. But there is a lot of risk going on there, and hopefully they take care of this rather quickly. And let me just close out. I was mentioning to you briefly about the world situation, and this is the first decade of the 21st century. There were almost 22,000 human plague countries, or human cases of plague reported in 12 countries. And you can see the Democratic Republic of the Congo, as if they don't have enough problems. They had over 10,000. Madagascar had over 7,000. And year in and year out, they're either one or number two or flipped. They're always the top two. But if you go down here, and there's the United States right here at number 11. So anyway, yeah, a lot of these diseases are already here, and by having this horrible sanitation issue, there is a risk. And I don't want to be hyperbolic, and I'm not going to be. I don't want to be political. I don't want to be. But something does need to be done about that. I mean, you can even recall that in 2016, I think the first hepatitis A outbreak that was declared was in California also, among the homeless population and the injectable and non-injectable drug users and the like. So yeah, we do have an issue going on there, and it's really time to take care of it before it does turn uglier. Okay, well, I appreciate you watching. If you like what you saw, leave a comment, give us a up arrow, a thumbs up, and hit the subscribe button. I always appreciate that. And I'll see you next time on the next Infectious Disease News Brief.
And don't forget to check us out at the website, outbreaknewstoday.com, the podcast, Outbreak News Interviews, which can be found on the website, on Apple Podcasts, Stitcher Radio, and Spotify, and the Outbreak News This Week radio show, which is aired Sundays at 1 p.m. Eastern Time in the Tampa Bay area on AM 1380 The Biz, or online streaming at 1380thebiz.com. And check out our social media presence, Facebook at Infectious Disease News, and Twitter at BackDman63. Outbreak News TV is a production of The Global Dispatch. Copyright The Global Dispatch Incorporated, 2019.